Hi, my name is Martha Sweet and I've been a member of the Madison nursing faculty since 2019. I'm going to do an NCLEX question walkthrough with you today. We're going to look at each one of the choices individually. So the question is, a client with myasthenia gravis is admitted to the med-surg unit. Which of these tests would the nurse expect to be prescribed for this client? Select all that apply. So just remember, with select all that apply, we're going to look at each choice individually and make a distinction instead of trying to look at all of them and then make our choices, because that's too overwhelming. So the first thing I want you to do is take the disorder first. So just ask yourself, okay, what is myasthenia gravis? Just remind yourself, and just in short, it's an autoimmune disorder that affects the activity of the neurotransmitter acetylcholine, and that leads to muscle weakness. So just kind of a brief kind of reaching back and reminding yourself of the disorder first, so that you'll know, are these diagnostic tests going to be helpful? So the first one, A, is the Tensilon test. So we know that Tensilon is a medication that prevents the breakdown of acetylcholine. So that, when it's injected by IV, if the person's weakness improves, and it's usually just briefly, then that's usually one of the confirmation tests for myasthenia gravis. So that one is correct. B, nerve conduction studies. Yes, those are used for myasthenia gravis also because they test for receptor antibodies. Lumbar puncture. So lumbar puncture is not used for myasthenia gravis. It is used for multiple sclerosis. So we want to make sure that we eliminate that one. EEGs. Those are also used in MS very frequently, but they're also used for things like seizure activity in epilepsy. They're not used for myasthenia gravis. So C and D are not correct choices. Our final choice, E, which is our EMG, is useful in testing for myasthenia gravis, especially if the provider is considering a different diagnosis. This is a way to confirm myasthenia gravis versus differential diagnoses. I hope that was helpful.